Should I undergo this surgical procedure or is it dangerous? Dear Mr. Doctor, as you know, I've posted before about my problem, eyelid asymmetry. The doctor who operated on me performed bleph procedure, but that hasn't worked, and now after a year, he proposed to lower down my right eyelid, that is upper, by Mueller muscle resection. He told me that the difference between eyelids is 1.5 millimeters and could lower down the right eyelid with this procedure, resection of Mueller muscle. What do you think? Is it dangerous?
Thank you for your question. You've submitted several photos with your question, close-ups of your eyes with varying degrees of the eyes being open, as well as with one photo looking down. And you describe in your question that you underwent blepharoplasty, you're not fully satisfied with the results, and according to what you describe, your doctor has noticed that there's a 1.5 millimeter difference between the two eyes and has suggested a Mueller's muscle resection of the right upper eyelid to lower it down to achieve better symmetry. And you're asking if it's dangerous. Well, I can certainly give you some perspective from my experience. I'm a board-certified cosmetic surgeon, a fellowship-trained oculofacial plastic and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. The procedure you described, Mueller's muscle resection, is a procedure that I've performed a lot in my practice, particularly for thyroid eye disease or Graves' disease. And just for clarification on understanding anatomy and then to address the question about safety, we'll go over some of the basic anatomic issues. When somebody has thyroid eye disease, there are the muscles that move the eye, called the extraocular muscles, can become inflamed and become tight. And amongst those muscles, it's been observed that there are, with the upper eye, as far as the eyelid is concerned, there are two major muscles. One is called the levator muscle, like the word elevator, and the other is Mueller's muscle, which is right behind the levator muscle. The levator muscle accounts for the majority of the movement of the eyelid, but the Mueller's muscle does account for about 2 millimeters of elevation. Now, it has been well known in oculoplastic surgery that Mueller's muscle, when it's affected by thyroid eye disease, can actually cause a tightening and an elevation. So one of the strategies is to actually evert the eyelid and excise and remove Mueller's muscle to get the eyelid to come downward. So as far as the procedure is concerned, I think in the hands of a trained oculoplastic surgeon, most likely the risk is relatively low. That is, in terms of the, when you say dangerous, is it dangerous for the integrity of the eye itself? Is it dangerous in terms of the ability to heal or problems with functionality of the eyelid? I would say in both cases it's relatively safe. Because it's done on the inside of the eyelid, there is no external incision. The area is very well vascularized, so it should heal fine. The only issue sometimes is with the foreign body feeling from the sutures, etc., that are used to close or repair the conjunctiva, or just to deal with the healing process behind the eye after this procedure is performed. Now, the only issue that may be is that it may not work, or it may not work completely. You may still have retraction of the eyelid, and you may not get the full correction that you want, at which point then you may need to do another procedure, such as a levator muscle recession or something called a levator muscle myotomy. I mean, there are different procedures for that purpose. So I think that you really need to have a discussion with your doctor, a detailed discussion about the risks and benefits. Understanding that within the normal population, a small amount of asymmetry is normal, But if this asymmetry is bothersome to you and it shows up in pictures and it really draws your attention, then and there is the history of a thyroid related issue, then the Mueller's muscle resection is a first line type of treatment to help address this issue. Sometimes when I have these consultations with patients, I'll tell them that we can have a plan A and we can have a plan B, so that when we do the procedure, what I do is I'll have the patient open their eyes during the procedure. I'll sit them up and have them look to see how symmetric they are. If the Mueller's muscle resection doesn't fully accomplish that, I explain to the patient what I would probably suggest we do at the same time to maybe achieve that certain height to try to minimize the need of a second operation. The reality is that when it comes to eyelid position as opposed to eyelid skin, you are dealing with a lot of variables that have to do with the swelling, the anesthetic, and the healing that can affect the position. This applies for eyelid retraction, it applies to eyelid ptosis. So you always have to be prepared for some type of revision procedure if that need arises. So again, meet with your doctor, get more details, and see what you're able to tolerate as far as this procedure is concerned. So I hope that was helpful. I wish you the best of luck. Thank you for your question.